call the Board of Health meeting opening at 6:32 p.m. Do we have anybody for public participation?
I don't currently see.
We will have the health director check our Zoom and our, see if there's anyone there to bring them in or anything. We'll give you a few minutes. Okay, Anthony?
Yep.
Let us know when you're. For those, if anybody is turning in, we're just checking our Zoom access to make sure that we can get everyone who wants to participate.
I think Aaron and Dan are going to be joining, not public participation, but Aaron and Dan are going to be joining us.
Okay.
Do we know if anybody who's going to be on Zoom?
No,
No.
no.
We may just not have anybody on Zoom today.
Okay, it's all right. Well, we'll continue on with the meeting, and you said that Aaron and Dan will be joining us?
Yes, they will both be joining us. by Zoom.
In person?
No, in Zoom.
In Zoom.
So I don't see them yet. Aaron's is updating right now, and Dan's just going to be joining us in a little bit.
Okay, all right. Can we look over the minutes from the meeting on June 26th? And are there any comments or any corrections?
I did not have any.
Did you see?
Okay, we do have some. Yep. Okay, so it is working. Dan just
Yeah. Okay, all right, so that's good. We do have someone. Hallelujah. That's good. Oh,
Hey, Melissa.
Hello. Come on in. You just opened the meeting. That's all right.
So now that we have a test subject, can I test Dan and try and put it?
You want to test Dan? Okay, we'll give you a couple minutes. Nice to see you.
Dan, can you hear us?
I don't know if you have this stuff. I can't remember if you were at that meeting.
Dan, can you hear us?
There you go.
You know.
You guys hear me? Okay, yeah, I'm good.
Great, can you hold on 1 second?
One second, I'm gonna try.
Meeting room?
Meeting room.
One second.
One second.
Okay.
Just trying to. Zoom is working correctly, Dan. So we're
Okay,
gonna put you in.
looks like I put them in the waiting room.
You
So
put her
that's
in the
good.
waiting room?
It looks like,
Is Aaron coming in?
well,
No.
I don't know, the name doesn't, there's no full name attached to this one, but I guess we'll find it.
Huh? Oh, sure. Why don't we just pull them right in? See who they are.
Hi, can whoever just joined the meeting identify yourselves for a public meeting? Oh, hi, the person that just joined the public meeting, can you identify yourselves to the board so we can move on?
I'm sorry, my system just came on. I didn't hear you before.
Oh, that's okay. Just want to make sure. Can you give us your name?
Sure, my name is Scott.
Oh, thank you. Sorry, we're just testing out the new waiting room feature. Thank you.
Sure.
Okay. It looks like everybody's in now.
So The approval, anything, do you have anything on the minutes of the meeting, anything to be corrected?
And now,
Can I have a motion to accept?
make a motion to accept the meeting minutes from May 15th. I'd second that motion.
All in favor?
That's on June 26th, sorry. I think I was looking at
That's okay. Just, yelling, all right? Just all in favor? Just do, and all in favor, Silva, okay? So moved, minutes are accepted, okay, thank you, Cindy. And is there anybody on that has anything to say for public participation? Okay, we will close public participations. Okay, we can move on. Next on our agenda is our update on our restaurant closures.
Okay, so we just wanted to talk to the board a little bit about, in the recent month or two, we've had a couple of restaurant closures. Dan and Aaron will go into a little more detail, but we've had a couple of issues, recurring issues at different restaurants that we are somewhat worried about. And so we will also present sort of a plan moving forward for all of our restaurants in Wakefield, how we plan to help them be more educated, give them more resources, and give them a chance to reach out to us with their questions instead of waiting for us to come and do an inspection and then not doing well. So Dan, do you want to go over some of the recent inspections?
Yeah, that sounds good. Can everybody hear me okay?
Yep.
Okay, if I start to cut out, just let me know. But yeah, so it all kind of started. So we had 3 recent closures, one with Brothers Deli, one with Blue Moon Grill, and the other one was, what was the other one? Well, the other one wasn't a full closure, it was Sakura, but we limited the menu for them after their inspection. And all 3 of them had rodent infestations in common at their inspection, which is something we take pretty seriously, and it's a big sanitation issue, obviously, because you don't want rodent feces in your kitchen when you're actually preparing food. However, that was not the only issue in these inspections. Brothers had a big problem with displaying knowledge.
Can I ask you to pause for a second?
Yeah, sure.
The next person. This is resident, so- Hi, the person meeting, can you the person do you mind identifying yourself? For the
Are they still there?
They're still there, but
Are they still there?
yeah, you can go.
Okay, sounds good. Yeah, so what I was getting at is the main issue for all of these closures was related to rodent infestations, but it was not the only factor. For example, Brothers Deli and Blue Moon Grill played a lack of knowledge with being able to run the business with very general practices such as foundation, cleaning, and just very general things with the businesses. But yeah, the main thing was the rodent infestations. Since these inspections, the initial inspections, we've required each restaurant to work with a food safety consultant to walk them over standard operating procedures, just kind of boost their education and knowledge of how to properly run the restaurant and how to keep it safe to prevent foodborne illness, and also clean up all of the lack of cleaning, rodent feces, and things of such nature. So that's pretty much where we're at with the restaurants. I know that Erin also had a great idea to host a kind of like a meeting or seminar with all of our business owners, all of our restaurant owners, in which we can kind of go over all of these things in detail with them. So it's not just like Anthony said, where we're not just showing up doing the inspection. We kind of give them a little bit of knowledge of what we're looking for and how they can prepare for this ahead of time. So kind of working on prevention of these issues rather than letting them happen and then we give them a slap on the wrist and go from it. So that's pretty much it.
Thank you, Dan.
Yeah, I have a question. Do you think that these three businesses having a rodent problem, is this indicative of a larger rodent problem that maybe we need to think about? Or do you feel like it was more related to the state?
It could definitely be a bigger issue, but without us actually, doing some sort of questionnaire or assessment of the community as a whole for the issue, we can't really make that determination. But I can definitely say, based off of complaints that we've been getting, that there has been an uptick in rodent activity throughout Wakefield. But it's hard to say because there's a lot of factors that go into it, and it's also summertime, so rodent activity goes up just by default in the summer and spring months.
I can speak to that a little bit.
Did, were any of these particular restaurants that had this rodent problem now, have they had any rodent issues in the past, like year or two, or was this just?
Yes, I think all of them had previous rodent issues. A lot of it is, we went to a rodent seminar today, actually, like the health inspectors. A lot of what we're going to be addressing with the restaurants as a whole is just better sanitation practices around keeping garbage outside, making sure there's no food sources inside, like in basements, grease interceptors, just all along their equipment, and just better training their employees to look for signs of rodents and to notify the manager so they can, do better prevention. Because by the time we're seeing it, that it's to the point where it's so bad that the restaurant has to close, it's going to take a long time to take care of that versus, just overall doing a better job with sanitation.
Thank you.
I have a question about procedural stuff with the inspections, and I know you're going to be posting them for the public on the town website, but I had anticipated, and it's perhaps just my lack of knowledge, but some type of information to the board periodically, like we meet once a month, but maybe a bi-weekly type of thing, so that I'm finding some of this stuff on Facebook or in the item, before coming here without any knowledge of it happening. So maybe you can just educate me on that, how that happens, or if there is a process for that.
Yeah, so historically, we haven't really made a kind of schedule notification for the board, at least, because generally, if things come up, we try to notify the board ahead of time, but these things, because we've already made a decision on their closure and they usually reopen somewhat quickly, we don't necessarily feel like we have to get that information out. We can, of course, if the board wants to know in a more timely manner, we can do that moving forward. We just never really established that schedule, I guess, ahead of time, so.
Yeah. If there was something to be more major,
Sure.
how would that be disseminated?
Yeah, so I think, without belaboring the point, we had a restaurant close for an extended period of time. This was about a year ago. This was gonna be a major closure. We already knew, they had a lot of work to do. So we then notified the board ahead of time, just so if there are any questions that they could know, in case the public reached out. These were considered, these are major enough issues that they had to close temporarily, but not to the point where we thought they'd be closed for like weeks on end. So we're confident that with the food safety consultant, they were able to get back on track pretty quick.
Gotcha.
So
Okay.
if we want to lower that threshold, if the board wants to know a little bit more, even if it's not as major, we can do that, but.
Okay.
Yeah.
And if I wanted to find, like, is there an organization, I know it's 3 towns that are connected now.
Yes.
Is there an organizational chart if I wanted to reach out to someone, for more information that might be on record, or how would
Of
that work?
course, yeah, so we keep all of our inspections, they're all public information, so Cindy actually handles all of our public information requests. So if you ever have any questions about any of our inspections or anything comes up, say you hear something on Facebook or and you want to confirm something, feel free to reach out to Cindy, she's up to date on everything.
Okay.
And
Because, if a resident asks me and I don't know anything about it, that's not really a good look,
absolutely.
And I was wondering too, is there a chart of what falls under the jurisdiction? Like you had mentioned, I think you said with the rodent issue, that's a state issue if it became a bigger issue. And so is there a list of what falls under the jurisdiction that I could?
Oh, you mean like the
Understand
job
and
duties of like
access?
the health department essentially,
Mhm.
yeah. So we cover a good amount of it, we can produce maybe like a outline of the things that we cover. We cover everything, so environmental health covers food, we cover housing, we cover a lot of our public health nuisances, that includes rodents. We cover a large swath of area, things like air quality, and there's some other things that we don't cover, some state things, so that would be like nail salons, that would be hair salons, those things are all state related. So massage is a state regulated form of function, so a lot of our functions, we have a clear delineation from the state, so we can.
I'm not necessarily looking to create more work.
No, of
Everybody, we all
course,
have plenty of work,
yeah.
but I was just wondering, what would be the best resource if I had questions, like to go to town hall?
Yeah, well, actually, because we are like physically situated outside town hall, but Cindy's a great connect for that. She works very closely with our inspector. Oh, Erin, actually, you wanna chime in? Sorry, I didn't see your hand there. Oh, I think you're muted.
So for board members, there's MAHB, and board members can be a part of that, the Massachusetts Association of Health Boards. And that's a really good resource for board members on what local health departments, can and can't do.
We talked
Awesome.
about that, having.
Yeah, and they have trainings for board members too.
The training is back. It's back.
Yes, exactly, in person. Yeah, it's a really good training. I've been to it before as well.
Did you do it? No, I didn't.
Yeah, it's a really great resource for board members. But also I was gonna say, whenever we get or not even public records requests, like we just get residents that ask questions, and send them to the board, the Board of Health at Melrose or at wakefield.ma.us. And, we just answer those all the time. We're kind of an open book with public records with, what we can and can't do.
Yeah.
Okay.
Yeah, so Cindy's the first point of contact, and then
Okay.
depending on what the record is, like she can reach out to like Erin. Erin's a senior inspector, Dan is the Wakefield inspector, and I'm the director, but generally they're closer to the ground day to day, so there's an answer that Cindy needs to get, she can reach out to them.
Okay,
Yeah.
thank you.
Is there anything else, Dan?
Not of significance, no. It was just, so we had those 4 inspections, at Brothers, Blue Moon Grill, Sakura, and, there was one more at Jade Gourmet, but it wasn't to the point of closure or restriction of menu or anything like that. But those are the inspections of significance, and they all kind of fall under the same thing where it was mostly a rodent issue that resulted in the closure of those.
And actually, Erin talk a little bit more about the PIC meeting, some of the ideas we might have for that.
Okay, yeah, Anthony, Dan, I didn't want to take credit for it. It was Anthony. Well, Anthony spoke to Coral, and Ruth and Coral, I think, used to hold these meetings periodically as part of the FDA voluntary retail standards. So
Gotcha.
those are the standards
standards
that
that
all of our
all of our
communities
communities are
enrolled in.
enrolled in.
Sorry, I'm hearing some
some double
noise.
Oh, there we go. I think it's.
Okay, thanks. Sorry. So we're enrolled in the voluntary standards, and those are like workforce standards. So standard 7 is meeting with industry. So we would periodically have meetings with our food establishments in Wakefield. And we would go over a bunch of things with them. We would, sort of a very abbreviated foods, like introduction to public health and food safety inspections, and talk about the risk-based inspections that we do, where what we're looking for are the foodborne illness risk factors. Just a brief overview of that. What we're looking for when we go into a restaurant, we're looking for hand washing, and personal hygiene, cleanliness. We're looking for cross-contamination issues, food sanitation, hot and cold holding, and then any other special processes. But what we've really been noticing recently is just, maybe because of the high turnover rate in restaurants, we're really seeing a lack of overall active managerial controls and standard operating procedures in a lot of food establishments. So there's really no continuity from shift to shift, and there's no, quote unquote, culture of food safety. And that's what we're really trying to get food establishments to buy into.
Yeah. So I think these PIC meetings could be really helpful. We were talking with Erin Kokenda, who's our economic development director, trying to find a way to walk the line of being very business friendly, but also encouraging food safety, right? So a thriving business scene is actually better for the health of Wakefield in general. So we understand that. We want to be active partners in that. But we also want to emphasize how important it is that food safety is followed. So we talked a little bit about how we incentivize our restaurants, especially those that are risk 3s and 4s, to come to these PIC meetings, and we had kicked around the idea of having them be mandatory for their permit renewal status for the next year. And so we really want to stress the importance of them coming to these meetings. We'll have resources there. We'll give them kind of a layout of what we've been seeing, and then also give them a chance to give us feedback, right? What are challenges they're facing? What can we do better for them? Because this is a two-way street. So we're still ironing out some of those details, but I do anticipate we want to run this PIC, or we want to maybe have 2 sessions so that the timing is better for some restaurants that can come in earlier, some that might be able to come later. But overall, we want to kind of get this done sooner rather than later, because we are coming up very closely into the fall, and then soon enough it'll be permanent. So we do want to kind of get these organized soon. So stay tuned. We'll give you guys more information as this comes up. Yeah. Any questions about the mandatory PIC meeting that we're thinking about?
That's a great resource.
Yeah. So I think it's an opportunity. Erin, Dan, did I miss anything else?
No, I don't think so. No, I think that was really good. Yeah, we really just want restaurants to be able to, have the tools to be able to also do their own, self-assessment, do their own inspection, like we do their own internal audits, so that when we go in, we're seeing the same things they're seeing. So,
That sounds good.
yeah.
Were there any other questions about, I guess, anything about restaurant closures or anything else food related?
Next on the agenda is the introduction of prevention outreach and the youth service manager.
Yes, so I want to start by letting everybody know that Amy Chirivalotti, our prevention and wellness coordinator, is actually moving on to a new role. She is going to be moving to the Galvin as a health teacher. She's been with us for a few years now, so we're very, very happy. We're excited for her. She'll be filling an adjacent role to us, I think. We will still be in contact with her. She'll be working with the kids. So I think it's a great transition. We thank her for all the work that she's done these last few years. The youth have expressed gratitude gratitude for all of her work with them. And she's been very fun. We wish her luck moving forward. But now we also would like to introduce Elizabeth Parsons. She comes to the town of Wakefield with over 20 years of public health experience as the Prevention Outreach and Youth Services Manager. Her specialty is alcohol policy and alcohol substance use prevention. So she's had many opportunities to work on this statewide. It's something that we have definitely looked at tackling. Town council has expressed interest in looking at our one-day permits and our alcohol permits in general. So this comes at a good time. Liz has a lot of experience in public health in general. So she started about 2 weeks ago. She is on vacation for a little bit and she'll be back soon. So we're excited to share some of those updates and the new direction Wakefield will be taking.
And she lives in Wakefield.
I met her at the wellness fair.
Yes.
Great.
And she used to be in Melrose. What was her title in Melrose?
She was the coordinator of the Mass Call 3 grant, which is substance use prevention that now resides fiscally in Medford.
Yeah. She's very good. She comes, I've worked with her before, you know, things here in Wakefield. She's very good.
Great.
Okay.
So is she gonna be kind of absorbed, like doing the role that
She
Amy had?
fills Catherine's previous role.
Okay,
Yep.
and then Amy's previous role also kind of folds into that, or?
Yeah, so her position will oversee Amy's now former position, I guess. That position we're gonna be looking at now and seeing is there, how do we wanna structure this moving forward? Because Liz is new, depending on what her vision is, what her direction is for substance use prevention, we're gonna give her a chance to kind of evaluate what makes sense for that role.
Okay.
So there might be a minor change, but.
Okay.
Move on now to health director's report.
Yes. Actually, while we have Melissa, I'm gonna let Melissa go first because she has many things she's been seeing on David, so.
Yes, we are seeing quite a few cases of pertussis. It's
Back.
yes, and I got a notice from the state and we pushed that out to all of our communities.
Well, for some of us non-clinical folks, can you explain pertussis?
Pertussis is, the easiest way to explain it is whooping cough. And so it often affects kids, but could affect anybody, and it's most dangerous for children under 1 and elders with any sort of lung problems at all. So, and sometimes it's characteristic to have this paroxysmal coughing episodes that you just cannot catch your breath, and there could be vomiting or not. And it can last up to 10 weeks. So it really is, something that's hard. And I think we'll probably start seeing more cases because school is starting. And right now, the state sent out something to us and said that so far this year, we've had 252 cases. It went way down during COVID. And now it's, we still have the rest of the year to get through. And so we're definitely going to be above 300 cases, I'm sure. I talked to one of the office practices and they said we're seeing at least 2 to 3 cases a week.
Is it showing up as like a breakthrough? That was why we put the second Tdap in, do you remember years ago? Is it getting into that school age, or are we going more into the adult age?
What I've seen in my own cases and coverage is mostly it's junior high, high school so far. They're getting it for friends, they're getting it at camp. Family, they're passing it to all the family members, including the mother. So it certainly can go to adults.
Do you have any information about the immunization status for these folks? They're getting it, like have they gotten it, like a Tdap booster, or is that impacting?
I have not seen, when I've looked it up online in MIIS, I have not seen Tdap boosters, but everybody has had at least one Tdap. So, you know, I think it's
Who's the second Tdap, seventh grade?
Uh,
The second Tdap, is that still seventh grade?
There's a whole like curve of like babies,
Yeah.
and
They
then,
do the baby, the Tdap, and then they do the one, and then the.
and every time you
Tdap.
get pregnant, you get
Yeah,
one.
yeah,
yes.
It's every pregnancy.
and grandparents also.
You should.
Yes.
Yeah.
So is it considered like a partial breakthrough if it's one?
That's why, years ago, it was only one, and then we saw the breakthroughs, and they initiated a second
That was about
Tdap
10
at,
years
yeah,
ago.
seventh grade.
Oh,
Then it came in about, I'm trying to think, oh, it's my second grandchild, 17. That was when we saw the huge Tdap breakout, protest South California, and it was mostly adults. So that's when they put it in for expectant mothers, fathers, and grandparents. Mothers are every pregnancy, even if they're pregnant twice in 1 year. And fathers are 5 now, are they still 5? And grandparents, and then like if a grandparent's taking care of a child, or
Right.
you're taking care of somebody, it's 5 still, I think, was that what it was?
I think that could be. I mean, I think with the mother, it was like passive immunity to each
Yeah.
child.
That's why they went with everyone. But there's still a lot of grandparents out there that don't get it.
Yeah.
Mostly OBGYNs are usually very strict about it and do remind you and ask for it.
It's hard though, it's hard to kind
Yeah.
of catch those other folks. They have to be motivated to go and see
Yeah.
their own.
Yeah.
provider.
And that's not something that's provided to the older generation, as we would say. We did a grant years ago, 17 years ago, I did a grant, and that's what we did, mostly was grandparents.
So also what we're seeing, although I don't think we've seen it in Wakefield, is an uptick in Vibrio cases. So be careful when you eat oysters.
That's why.
I've had 3 so far this summer.
How are the folks?
Lots of GI problems that seem to drag out. Nobody that I talked to had their diarrhea resolved. They had antibiotics and it's sort of trickling off, but still going
It's
through
miserable.
it.
Yeah.
Able to trace it to a particular spot?
I usually end up having to hand it off. I can identify the restaurant that most likely they got the oysters from, but then the Eppies take it. We're supposed to find out the last 4 digits of the credit card that was used and get permission for them to go and get the actual receipt from the restaurant.
Wow.
To be able to track it back, so they can then go to the restaurant and identify what tags the seafood has, so they can identify the location.
We had that very bad case last year here in Boston. The guy that was traveling, was a gentleman traveling here. He was very, very ill. We had a really bad case. It was one of the talk about ones. We had a few seminars on that case. The state did. It was very interesting because I think the person had realized that they were very, very ill and went to the hospital right away or otherwise, but they never traced. I don't think they found the actual. So it was he had eaten at 3 or 4 different places, so it was so definite too. So hard to find.
The other thing we're seeing is, you know, salmonella and Campylobacter, summer barbecues and everything, so. I haven't seen anybody who was camping and had contaminated water or anything like that.
Giardia.
Yeah, Giardia.
Yeah, wow.
I've been seeing more C. diff at work.
Yes.
We're treating a lot of our population, we treat them for Helicobacter pylori, and it's a long, pretty intense antibiotic regimen.
Yeah,
And I've had a couple people develop C. diff after completing that for the extended use. It stinks, it feels crummy, we're like, we wanted to cure one problem, but we probably
Created
gave you
another.
another one, yeah. But more recently, we've been seeing that.
so the other things that are going on, Sandy is glamping in Nova Scotia.
Good for her, that's
I may
wonderful.
not, yeah, I may not be up to date 100%, but we've already set a couple of dates for flu vaccine clinics. And you guys have graciously agreed to help. The senior center, we don't need you for the senior center, but that will be on October 7th. Then there will be the AmeriCal Civic Center on the 26th. And
That's the one, that's Wakefield's on October 26th.
yes. And if you can't,
That's
Wait.
APHA.
You said this, the senior center, you guys are good. You and
Yes,
you and
I
Sandy
think
have
so.
that. All right, but the 26th,
10:26, we could use you if you're available.
when is, like, what times?
I think it's gonna be the full day, but I'm not sure.
What's 10:26? Is it like, is that the?
It's a Saturday.
It's a
I think.
Saturday,
Oh,
it's the
it's Saturday,
usual
okay.
Saturday.
Yeah,
At AmeriCal?
Yeah,
Oh, the AmeriCal, oh, right, the family clinic. Oh,
Yeah.
okay.
It'll be
It's everybody, it's
everybody.
adults, kids. the whole-
Yep. And it will extend to, we'll offer it to people from Melrose as well.
Okay.
And then there'll be,
Well, and so.
they can, yes, and then they are also welcome to come to the clinic at Memorial Hall in Melrose, if the date hasn't worked out for them to come to the Wakefield clinic.
I think we do that AmeriCal clinic like 9 to 1.
Oh, okay.
yeah,
Yeah,
you're right.
because
9 to
after
1.
like noon, it kind of tails
Tails
off, but
off,
we
okay.
still capture some soccer.
Because of the
goals.
game, the sports schedules.
And you
Right.
can, and you can do shifts. We're looking for both vaccinators and administrators, or someone who's willing to just sit at the computer and take some basic information on color, but we're looking for both administrators and vaccinators. So if you can do like partial shift, that's also fine too.
Oh, I'd love to help you, but I'll be in Minneapolis at
Well, we-
APHA.
We'll get you for town day.
What? Yeah, and then I know that the 29th is Melrose.
Town day is September 21st.
Yes.
We don't know if we'll have our vaccine yet, for sure, but it looks like it may come in, because I just got notice. So, at least I got notice in Melrose. I haven't seen Sandy's email, so I don't know.
That was our
for sure
biggest
yet.
one.
That
So
was
we
last
should
year.
have.
Yes, it was farmer's market, 9 to 12, and then town day.
Oh, it's like the whole day, like clinic in the
Yeah,
morning
it
and
was
then clinic in
split,
the
yeah.
afternoon.
Remember how we did it
Yeah,
last
okay,
year?
okay, okay.
I think
Two
we ended
different
up,
locations.
we ended up going inside, it was great.
Yes.
Hmm.
But I think one year, when not last year, the year before, we did like 140
I remember, yeah, it was
vaccinations.
a beautiful day,
Yeah, it
yeah,
was, yeah.
Cindy's son was helping.
We had to pull was it the town day one?
Yeah.
Oh, yeah, we had to pull everybody.
Everybody.
It was-
All hands.
Yeah, we're like, okay, you're not gonna be able to walk around, we need you.
Yeah.
So, more dates to come from more places.
Okay.
And also the third thing is camps are just about wrapped up. And so, Sandy has been great, she's been really diligent. There is a huge push by the state to do a much better job of making sure that all the camps were, had their policies and procedures up to date, that all the medical things that we were looking into, monitoring the med logs and everything. And there's gonna be a wrap-up meeting for Camp Q after Sandy gets back, just to go over a few things with them. A re-education sort of activity. And I think that there's probably more camps in Wakefield that we're not reaching, that we're gonna have to start identifying. So that's it.
I guess the last two things that I was gonna mention related to nursing was, we did have our first triple E Eastern equine encephalitis case in Middlesex County, not here, but,
It was, I think, down in
was it not here? In Raina? Oh, okay.
someplace
Maybe we'll-
very far south.
How far south, okay, so it wasn't even in our county.
No,
But,
right, unless this.
That was first state, first in the state. right?
Yeah, but we did have actually
West
a
Nile.
West
Yeah.
Nile case
Yeah.
that was in Middlesex County. They won't tell us. They will only tell us that county specific.
Would you know if it was in Wakefield?
Yeah.
Yes,
Yeah.
absolutely. They would tell you if it's in, you know, I would get notified.
So it's not in
but
Wakefield, but
It's not in Wakefield, Melrose, or Stone.
Okay. Alright, carry on.
Just something to keep an eye on. We have had positive mosquito samples here, but we just haven't had a positive for, case.
Oh, 10 positives?
No, we have had.
Have had some.
Yes.
Oh, some, yeah, just some samples that have been
And they
collected.
sprayed already.
Yeah.
Once
Yeah.
they did
They've
that.
already sprayed. I believe there's still more
It's
to come.
normal.
They did some kind of like intense spray, I think over near the lake, right? I was
Yeah, I
there
think it
this
likely
morning
was,
and
yeah.
like where they're doing the construction, where they, I think they aren't mowing. It seemed like they did, like they had signs like, do not go in the grass.
Yeah.
We sprayed it.
But that's normal, to get a couple.
Yep.
Can't control the
is.
bugs when you got a net over the town.
We'll put that in the budget next year,
I was gonna say.
okay.
I always say, where's Batman with the net?
That's good, so. Okay, so rapid fire, Wakefield Convenience. About a month and a half ago, sold a flavored tobacco product.
Where is it, Wakefield?
Wakefield Convenience is by the tracks off of North Ave, so if you're at the intersection of
L,
Um,
Elm and North, is that right?
Yeah.
it's on- Or Elm, okay, you're
where the
right.
laundromat is.
Yes.
By the
Oh, yeah,
Yeah, so across the
yeah.
baseball field, across the track.
Yeah.
So Wakefield Convenience sold a flavored tobacco product, which is illegal in Massachusetts. So they were hit with $1,000 fine and they were asked to suspend for 5 days. This is their first offense in the last 3 years, but this is something that we are trying to prevent. So Maureen continues to do adult and youth flyers as part of her compliance program.
How did this happen?
We had an adult buyer go into the store
And ask
asking
for it?
for a flavored product and they came out and they.
I mean, they've been illegal in Mass for how long?
Many, several years.
5, like maybe?
Yeah.
Yeah, easy, yeah.
So really having possession of a flavored product is no longer just a mistake, it is intentional.
Right,
Here in
yeah.
Massachusetts. So,
Means they probably have sold many before, just
Sure.
haven't been caught.
Yeah.
so, we've heard, through the grapevine, different places, sell tobacco products, sell flavored products. Sometimes they don't sell during regular business hours for town hall because they think that we're not gonna be checking outside of town hall hours, but we do. So, we will be on that throughout the year. Fortunately or unfortunately, we did catch this one. We made it very clear to them that there are consequences for selling flavored products. So. We are keeping up with it. Tobacco invents a new product every day.
Wow.
Stay on it.
I feel like we haven't had one of those since, have we had one of those since?
It has been a while.
Yeah, I mean, selling to minors, we've had like,
Yeah, selling to minors, that's, I will say Wakefield is generally pretty compliant. A lot of businesses do follow the rules here. But, something like a flavor, like a sale to a minor, it's also not condonable, but sometimes you make a mistake, sometimes you have a new clerk.
but this stuff's
But
illegal in the entire state.
Sale of a
Yeah.
flavored product, that's been
It's
legal in
true.
5 years
That's
now, so
true.
that's not.
How many
Not a
tobacco permits, you know how we had our thing, how many tobacco permits
Yeah.
do we have?
22 now?
We're down to 22,
22?
we used to
Down
have,
22.
we used to have 20, we used to have 29, then we dropped to
Yeah.
25, and then once the board closed the permit transfer loophole about a year ago, or 2 years ago now, that number has since dropped to 21.
Not bad. Pretty successful.
Yes.
So, we've already gone over the restaurants, we do have good news, 2 restaurants will have opened, since the last board meeting, the branch is now open where
yeah.
Greater
Yeah.
Pizza used to be.
Yeah,
Greater
great,
Pizza
great
used-
pizza,
or Great Pizza,
great
Greater
something,
Pizza.
it's right next to the dance studio.
Yes, next to the studio near the church, I think.
Church.
Yeah,
Um,
Sarah Church, yeah.
So the branch is now open and as of this past Sunday or Monday, Boss Mama in
Oh,
the
yeah,
Boss
right,
Mama
yeah,
things is now.
What do they
open.
do there? What's,
Boss Mama is
Tap.
like a tap room, they have food, but they have
Beer.
different beers and mixed drinks on tap, and then they have kind of like American, I would say like American.
Like a
bar
pub
with
kind
the-
of
yeah, like a
thing?
pub scene.
alright,
They have now passed pre-opening inspection and they're all good to go, same with the branch, they do mostly pizza and wings and
Yeah.
sandwiches, but they're,
On the Boss Mama, you pour your own beer, is that right? Somebody told me
That's
that.
what I understand, so when you go in, the
Yeah,
model
we
is,
go in and
you get like,
Wow.
you give your credit
Self-service.
card, yep, you get a
Wow.
tap card, and they have like a 2-drink monitor, so you can go up and like, tap your card, and there's an attendant there. It's a very unique system, yeah.
Okay. What's the deal with the roast beef place that went where the Heroes place was, the old leases?
Yes, they have
Yeah.
also opened.
Yeah, they're.
Roast beef,
Yeah,
like
Dan
Wakefield
actually
roast beef or
inspected
something?
today.
Yeah, Wakefield
Yeah.
Seafood Roast Beef,
Yeah,
yes,
yeah.
they have also opened, I think they opened actually before our last meeting. So
Yeah.
they've been open for like a few months now, they passed pre-opening, they're all good to go. And the new restaurant as well. So, be a lot of new restaurants in Wakefield are very well.
And Way's Asian cuisine is,
Way's Asian cuisine, yes.
Oh,
Way's
how's that
Asian
going?
cuisine opening up in the old bamboo house spot.
So-
They're not open
Very
yet, but they're undergoing pre-opening
Must
inspection.
have done some pretty significant work in there.
Lots of significant physical changes to the structure, it's an all new crew.
Is it gonna be
so
like an eat-in place or more of a
I think
takeaway?
Oh, yeah.
it's gonna be eaten, I
Yeah.
think there's like over 20 seats. 20
Oh.
it was a good size as being, I don't think he.
Yeah.
I don't know exactly what, but they had a lot of seating. in
They had a
Bamboo
lot of
House,
seating, they
didn't
had
Yeah,
we
they
had
did
20 to
have, yeah,
25
that whole
seats.
big bar.
Yeah.
I thought like before they were kind of at the point, well, maybe it was COVID, they were just
Yeah.
doing takeaway.
Yes.
kind
Oh,
of-
they
had
did
switched
it one
to
time,
takeaway.
just do takeout after.
I believe the intention is that they're gonna move back into like an in-person seating.
But
Okay.
will that restaurant be under the same landlord? Are they paying rent to the same
Yes.
person?
What I
Do you know?
understand, it's the same landlord.
It's the same
Yeah.
landlord. So he has fixed up, I would imagine, what
they
Bamboo
completely-
claimed that.
They completely
never done.
revamped the restaurant, they tore everything out, it was down to the cement and the studs.
Wow.
And they
Yes.
replaced
Wow.
basically everything in there.
Nice.
I mean,
So,
that had to happen.
yes, they were long overdue for a physical growing, so.
But the other, we have two other food establishments also
Correct.
in that strip mall. And Moraines
Early
and
Early harvest.
Early Harvest. Have they had any difficulty and problems with the quote landlord, the way that Bamboo did, or? That we should be
Not
extra.
that I'm aware of, we've been there for a few
Yeah,
inspections, we haven't really
problems
had
at all.
heard any.
Yeah.
I mean,
Did
in
Bamboo
general,
House have a problem with that?
With the landlord?
Yeah, weren't they
Well,
saying
yeah,
that
they
that was-
claimed that he had fixed the windows and all that.
That was part
yeah.
of.
right,
That was
Share.
their whole big thing, so that's why I was wondering, is there a problem with that landlord? Do we have to like kind of keep a little bit of an eye, our inspectors? But there's never been any problems with those other two, they've been there for years.
Yes,
and
not-
they've
not
never
any
had a problem.
No.
yeah, we haven't heard any of that, it's just. So very, very excited for some of our new restaurants, we had the Healthy Living Expo Saturday on the 10th, thank you for coming.
Yeah.
It was-
Harper was there too,
Oh, yeah?
mixing it up. Yeah.
Yes, we had some help from Harper.
Oh, yeah.
Painted some rocks. I
She painted a
remember.
rock, she got her face
Oh,
painted, yeah,
nice.
exactly.
Oh, I missed
She
it
ate
this
apples
year.
from the food pantry.
Oh, yeah.
Oh, yes, I
Yes, I
did.
knew
Ah,
somebody
like-
who said they met her, that's
Yeah.
right, somebody told me they did meet
Yes.
her.
She has a pink camo cast.
Yeah,
Oh,
she's got
yeah.
a broken arm, yeah, so
Oh.
she's got a dragon her pink camel cast. Next week she gets that,
Oh.
hopefully, yeah, as long as everything's good, yeah.
We had some help, I want to give a shout out to Jason,
Yeah.
Stone was, he stepped right in, coordinated with the chamber, John Smolinski and the chamber put on a great event every time. The Healthy
Nice.
Living Fair is just one of them, but it's
I
great.
missed it this year.
Yeah, it was good weather,
Yeah.
we weathered the storm, it was like 8:50 when the storm lifted, it was pouring rain and then it
Yeah.
stopped and then the sun came out, it was nice.
Yep.
And the fields dried miraculously.
Mhm.
Sandy and Melissa came, they were able to give out tick information, mosquito.
Liz was
Liz
there.
came, yeah.
And Karen was there.
Karen Burke was there,
Yeah,
so we
Karen
shared,
Burke was,
we shared space with Karen Burke.
Right.
From the senior center. And, yeah, overall, it was a great event, so.
Sorry, I missed.
It always next year, anyway.
No, I don't know, you can look at the month it's in.
Okay. And then it looks like the last thing that we are gonna go over tonight is Town Day. So Town Day right now is scheduled for September 21st. Town Day is from 1 to 4 p.m. That's it? Okay, 1 to 4 p.m. I guess it's after the farmers market that day. So we will be there potentially, let's do a shot, so we don't know yet. Yeah.
Pending.
Depending if it comes in time. But we will have plenty of other stuff going on. The youth will likely have their, youth action team will likely have their own table as well, so we'll have a lot of different things going on. And then there's a rain date for the 28th, if town days rained out this year. That's all the exciting stuff.
Melissa, if you do get enough vaccine in, will you do also flu shots at the farmer's market that morning? Are we scheduled that, is that our day yet?
We actually ordered less this year,
Oh, that's
but
right. we did.
I would prefer to give it out as soon as we can and then order more.
Cause you had to
Then-
send some back, you said.
Yeah, we had to send doses back, and so many people go to CVS and Walgreens now that the sooner we can, hold our clinics and make people aware of them, I think that they might come to us.
Are we doing COVID? COVID?
We're not doing COVID, just because we sent so many doses of flu back. I was a little anxious about getting COVID vaccine this
I
year.
do think people like to get it from us. Like,
Yeah,
I
definitely
think,
do.
especially on these, like, community gathering days, I think people like a whole family can get it done, or like, even at the AmeriCal, I think. I think
It
people
is,
like that.
it is also somewhat cost prohibitive for us to buy the
Yeah,
COVID
it's
vaccine. It's
expensive.
actually a lot more.
No, no, I agree,
Oh,
I
yeah,
agree, yeah, I'm
yeah.
just saying,
Absolutely.
I think it's nice that we do it.
Yeah.
It would be, I get it, it would be
Yeah.
cool, I think people's interest in getting that vaccination is waning also.
There was a brief discussion today, so we're part of a 6 community group. It's Melrose, Wakefield, Stoneham, Malden, Medford, and Winchester. It's called the Public Health Excellence Grant that we work on. There was some interest in lobbying the state to, if we want to do like a regional clinic, since none of us individually can really afford to purchase COVID vaccine, but if we want to do like a regional thing, we could coordinate, have transportation to a central location, that sort of thing. So it's something that we're looking into. It's definitely not, set in stone, but something that we're looking.
It's definitely still out there.
Oh, yeah. Yeah, for sure.
You mentioned the COVID being expensive. Does the town pay for the flu vaccines as well?
Yes, so in our budget, we have a revolving fund, and so what we do is every year we pay out of the revolving fund, and we get reimbursed for both from the insurance, and so it's free to the residents, but we get reimbursed by insurance, and we get a small administrative fee, or administration fee.
$7.50.
Wow.
So we essentially close to break even, maybe a little bit each year. But that just goes right back into purchasing vaccine for the next year, so it's somewhat self-sustaining in that sense.
How do you
So-
bill their insurance?
When they
So-
register.
When
So
they,
we actually
they
take,
collect that information.
we take everybody, so even without insurance, it's fine, but the vast majority of folks do come with their insurance, the insurance then reimburses.
The administrator will register and take
Yeah.
the information at the time.
Is the state not giving out any vaccine this year, or are they still gonna just do it for the children? Will you be able to get so many for anyone who doesn't have it, or children?
We would have had to go through their whole process. And last year, I didn't even apply this year for our 3 communities, but last year I was eligible to get 10 doses
Yeah.
for Wakefield.
Yeah. 10.
Yeah,
Wow.
and for the paperwork that it
No,
requires.
yeah.
which is-
A lot of work, yeah. What is the COVID vaccine up to? What's the price on that, do you know? That's
I feel
still,
like,
130, I don't know,
I
actually.
think it was. I don't want to misquote, but someone told me that they were looking into purchasing it, I think it was like 14 grand for like 200 doses or something.
yeah, I was gonna say that, I thought,
I
yeah,
think that's the number
I
that they
heard
were
really
into today,
high up there,
yeah,
no one has the money. CVS and Walgreens.
yes, they always have.
And Winchester.
Yeah, Winchester, is she doing it? I haven't heard, I've seen, I'll see her on
I
the.
don't think it's, I
Up
don't think
there.
it's a vaccine, Winchester is.
I don't know.
She did do some COVID, they had some left, and then they also do shingles, 'cause they have
Oh.
extra money and.
That's expensive.
It is,
That's really
shingles,
expensive.
yeah, no kidding. TB testing is even
Yes,
getting more expensive, and that's sad, that's very sad, because the health departments always did it, but it's because of the timing with the vials.
yeah,
What you open is only good for 30 days. and
well,
You
each
get
one's
one
like
test.
10 tests. You
That's
get a-
popular?
Yeah, it's very expensive too. You can go to CVS for that, I know that. That's where I got it.
Just get a blood test from your PCP.
I'm fighting with somebody over how often they should be doing them. reading of the new TV laws.
Can I also say that in Melrose, Wakefield, and now Stoneham, we have always recruited people to help administer the shots. There are a number of communities that actually pay people to, which increases, the cost to your department. But we have been lucky enough that people are generous with their time and are willing to help, even if they don't live in our communities.
Yeah, unfortunately.
I think it's important to maintain that crew of folks too, like routinely be like, hey, like, here's what's going on, like, we appreciate everything you do, like.
I have found, I try to do that, and I found that it's dropped off since COVID. In fact, I had dinner with one of them the other night.
Come back, please, come back. I know a couple nurses, if you need some more, in Wakefield.
We could always,
Yeah.
yeah, something outside. Okay, I think that's pretty much it. Was there any
Question
other?
about
Yes,
your
please.
spa update, anything?
Yes, so there was one new establishment that moved into an old yoga studio next to Dino's.
Oh, yeah.
By Dino's by Jade Gourmet before, I guess it's called, I didn't know this, it's a county thing, it's a Four Corners, what they call
Four
it.
Corners, that's right.
The place that had the fire?
Today.
Yes,
Yeah.
close to the place of the fire, yeah. So I learned,
feel
I
bad, I
learned a little
did.
something. Elaine called me not a townie today.
Yeah, and I said to him, I said Four Corners, and he said to me, where's that? I go, Rose Street, what are you talking about? I go, well, you can tell you're not a townie.
Yes, but there was a new, no ideas.
You got a lot, still got a lot to learn.
I'll throw a dart at the map and I'll do more accurate than what I can
They go pretty good though.
But we did have one new establishment move into that spot. They are a bodywork establishment. We went through all the new regulations with them. They actually have all of their like customer logs, they have the medical releases,
Oh.
they have everything that we talked about putting into the bodywork, they are now following, at least in the beginning now. So the shades we talked about, so all of it is in line right now. We will obviously go back for a re-inspection at some point, but the new establishment looks like it's following all the guidelines right now. We have slowly started to evaluate all of our current ones, all the ones that we do know of, the ones we took a field trip and we found. So we will start kind of rolling that out probably in the next week or so. Hopefully, we have a plan on Thursday to start going to some of the establishments, and then we'll move on from there. We will also likely schedule with an interpreter to go out with us, just so we're anticipating that there's going to be some establishments that maybe they're more comfortable in Cantonese or Mandarin. So having an interpreter with us would be very.
This new place that opened, were they in business before? I mean, since they seem like they
Not
know
that
it's
we know
following
of.
everything.
It sounds like she has the practitioner has practiced in other places, but has not owned or.
So more or less
worked in a
know the rules and regulations, yeah.
Yeah.
That's nice, it's good.
So we will continue to work on those establishments. Cool.
Anybody else have any questions or comments or anything? Our next meeting would be,
September.
yeah, September. September 18th. Anybody have any,
I have no conflict.
September 18th.
Yeah.
That's what I hang up the calendar.
the 18th, any problems with that, anyone?
Same thing, this room, 6:30.
Cool. Yeah, okay, so, if we could may I have a motion to adjourn the meeting?
I would make a motion to adjourn.
Second motion, okay, all in favor? And so be, we will see you on September 18th at 6:30.
All right, thank you.